that. And sometimes if you go to put your deodorant on and you don't have a bra or shirt on, then you might notice that there's an indentation that you did not have before. Or if you notice that the skin looks really swollen and thickened, kind of like an orange peel with dimpling in that regard, that's something to bring to our attention. If you notice that you have this kind of scaliness appearance, it's almost like someone may have put a lace over your nipple. That's something that is sometimes an indicator that there's cancer going on in the breast, and people will find that their nipple is very itchy and looks dry or ashy, but it doesn't just get better with lotion. And then, of course, if you have any nipple discharge, we really shouldn't have discharge. You can have it, and it can be normal. But if you all of a sudden develop discharge where you notice, most people will say, I took my bra off, and there was a little stain inside the cup, or I woke up this morning and on my nightgown or shirt, there was a little bit of a stain of like rust color or brown looking fluid. That's something we need to know about. It could be blue, a brownish color, it could be green, it could be milky looking. The thing is that if you're not breastfeeding and you start having nipple discharge, we need to know about it. Doesn't necessarily mean that there's cancer there, but we need to be able to prove that there's not cancer and that we don't have to do anything about it. And then the last of the 7 signs is if you notice that your nipple is pointing the wrong way. So I like to say, don't pick up hitchhikers, right? We're all taught that. Don't pick up a stray, don't pick up a hitchhiker. So if your nipple's hitchhiking, you wouldn't pick that up either, right? So that's something, if you see your nipple hanging out to the side or up or down, pointing in a direction anywhere other than straight ahead, let us know, okay? These are things that you should not keep to yourself, because these are reasons that even if you had a mammogram 2 weeks ago or a month ago or 6 months ago, it means something has changed and we need to look at it. So when we think about breast cancer, just as I said in the beginning, that when we say cancer, it doesn't really just mean one type. The same is true for breast cancer. There are multiple types of breast cancer. So when you hear that someone has breast cancer, it sounds like it's a very generic term when the doctors are thinking about it. Because what we're thinking about is, well, what type of cancer is it? Is it that cancer that arises in the ducts, the tubes that carry the milk to the nipple? Is it cancer that arises in the lobules, the milk factory? Is it cancer that is isolated to the skin and lymphatics of the breast, which would be called inflammatory breast cancer, which would be the most aggressive type of breast cancer? And then also we look at breast cancer and think of not only based on where is it originating in the breast, but what is that cancer expressing? So most cancers, not just breast cancers, express something, some protein or hormone in the body. They respond to that for growth. And when we think about breast cancer, that's really estrogen and a protein called HER2. And so what we're wanting to know, is this cancer estrogen positive or is it estrogen negative? Is it HER2 positive or HER2 negative? Now, the specifics of that don't really matter as far as people really remembering it, but it does tell the doctor how to treat your cancer. And so that's very important as well. And another reason why I tell patients is that you cannot, if you're ever diagnosed with cancer, you can't always compare your situation to your neighbor who had cancer or to someone else, because your specifics of your cancer may be very different than that person, even though you both have breast cancer. So give a thumbs up or a head nod if you think breast cancer can occur in young women, right? Absolutely. Unfortunately, there's no age restriction. I wish there were, because I don't like to see the 20-something-year-old women with breast cancer. Not that I like to see 90-year-olds with breast cancer, but at least we all can kind of grasp our mind around that a 90-year-old has lived a very long, productive life, but a 20-year-old, I have to try to get that person to be able to live to 90 and still treat and cure their breast cancer. So breast cancer does occur in young women, and unfortunately, the younger you are when a cancer occurs, oftentimes the more aggressive that cancer is. And so oftentimes the more of a challenge it is to treat. So am I at risk for breast cancer? Yes. If you are alive, you are at risk for breast cancer or any cancer development, unfortunately. So it is very important for us to know then our family history. I cannot stress to you enough the importance of family history. I can say that now I feel like people do a little bit better job of knowing their family history. But a lot of times for us, especially I find in more minority families, the family history is kind of shrouded in secrecy, and it should not be, right? We have to be comfortable saying, you know, Aunt so-and-so died from this, and not Aunt so-and-so got sick and died. Like, we have to be comfortable telling what the problem is and not being ashamed of that. Because knowing that person's family history gives your doctor some tips off on what to order or look for or how aggressive to screen you for something as well. And also because there are some gene mutations or gene abnormalities that can be passed on from, you know, parents to their children. And so we need to know that about 5 to 10% of breast cancers have some type of genetic relationship. So whether that's the genes that most people know about, like your BRCA1 and 2 or BRCA1 and 2, a lot of people know about, like Angelina Jolie, that made that very popular. So those genes, but there are another 68 genes that we test for that show some type of increased risk or association with breast cancer development or other cancer syndromes that knowing your family history really tips us off on, to know what to look at. And so then also knowing your medical history. If you've ever had radiation exposure, so there are some people who between the age of 10 and 30 may have been diagnosed with a type of lymphoma that requires radiation to the chest. Although radiation is treatment for the cancer, radiation in that young age group could put them at a higher risk of cancer development. And so we need to know these things. And then there are also these kind of biopsies that are oftentimes benign, but can have an associated risk of cancer development. And so you may have some atypical or abnormal cells if you got called back for a biopsy, and the doctor could have said the biopsy is benign, but you need to know what they saw in the biopsy, because that, again, tells us whether we need to screen your breast more aggressively for cancer or not. And then there's some other things that you can't really, are risk factors that you can't really adjust too well. So we don't get to determine how old we are when we get our first period or our menstrual cycle starts, but if it starts before the age of 12, which is actually more common these days, then you have a higher risk of breast cancer development. If you have your first child after the age of 30, well, as society has gotten more advanced, women have had children later in life, right? Because they are trying to progress themselves or their own career, or life just kind of challenging sometimes to find a mate or someone to be with. And so, again, those people have a higher risk of breast cancer development. If you go into menopause after the age of 55, you have a higher risk of breast cancer development. And the reason for that, or that association or link, is because your body's exposed to estrogen longer. So you have more times of estrogen exposure. And so increased estrogen exposure increases the risk of breast cancer development, especially when we know that most breast cancers respond to estrogen, meaning they're using estrogen to grow. So that's why we say things like breastfeeding, because you don't really get your period then, is good. Or if you're someone who got pregnant at a younger age, potentially, than you have, or had more children, then you had more times where you had less estrogen exposure. Questions about any of that? Because I know sometimes that can be a little bit tricky to grasp. Another thing that people sometimes ask is, well, I have breast implants. Does that mean I have a higher risk of breast cancer development? The answer is no. We can detect breast cancer just as easily in a breast with implants as we can in a breast without. Sometimes we have to do more things to the during the mammogram. Thank you. But we can still detect it. There is a type of breast cancer that is associated with implants, but fortunately the FDA has allowed us to take those implants off the market. So people should not be getting these textured implants that put them at risk for a type of implant-associated lymphoma. That's not a traditional breast cancer. So now that we talked a lot in a short period of time about breast cancer and the types of breast cancer and the risk factors, I think the real thing to focus on is how do we lower our risk, right? Because I've told you congratulations, you're alive, you're at risk for breast cancer. But now what things can you do to helpfully lessen your risk of breast cancer? So the first thing, and probably in my mind sometimes the most difficult thing, is to stay lean after menopause or even before menopause, to stay lean. Food is good. We like food. I myself like food as well, but we know that a diet that is heavy in processed nutrients increases your risk of all types of cancers, so a lot of nitrates and things like that. But also a diet that's heavy in sugar increases your risk of cancer development, as well as heart disease and other things. So you want to try to eat a well-balanced meal, right? So you want a diet that where your plate primarily has 2/3 filled with like fruits and vegetables, and not starches and carbs and all those things that taste really, really good, but aren't as good for us. So get active and sit less. This is really important. Through research done through the American Cancer Society, we know that people who exercise at least 150 minutes a week, which sounds like a lot of time, but if you think about it, it's 30 minutes 5 times a week, they are able to lower their risk of cancer recurrence if they've had a history of cancer, but also cancer development. And the reason is because you're just out, the leaner your body is, the less fat you have, and the less estrogen you have, because we make estrogen even in our peripheral fat cells. So aim for at least 150 minutes of moderate exercise. It doesn't have to be anything strenuous. You can really just be walking. You just got to get your heart rate up, yoga, running, swimming, those kind of things. And then also try to aim for some strength training, because strength training builds lean muscle. So limit alcohol. So not drinking at all, of course, is the safest choice, but some people will still choose to indulge in an alcoholic beverage. The thing is to know that the recommendation is that you should have no more than 1 drink a day, and so that means no more than 7 drinks in a week. But that does not mean you should have all 7 drinks in one day, right? Like, that's also not good for you at all. So the other thing is to know what is a serving of alcohol, and I think most people don't realize what that is. So it's 5 ounces of wine, it's 1.5 ounces of liquor, or 12 ounces of beer. And so I say it's really important because some people will say, they kind of teach you in medical school when you're asking these questions, you have to be really detailed with people. Because you might say, well, how many drinks do you have a day or a week? And they say, oh, 1 or 2, but you don't realize that their drink is a 32-ounce cup. And so you're thinking 5 ounces and they're thinking 20 ounces, but a cup is a cup, right? But it's not. All cups aren't made equal. And then choose to breastfeed. You know, I say this part with a little bit of a grain of salt, right? Everyone can't breastfeed even if they wanted to. But if you have the opportunity to, and you can do it with little difficulty or tolerable difficulty, and still give your child the appropriate nutrients, then try to do so. We say at least 6 months of breastfeeding exclusively after childbirth helps lower that hormonal changes and reduces your risk of breast cancer development. And then for me, this is one of the most important things: talk to your doctor. Like, I cannot stress this enough. I find that when I do some of these talks in the community, or people say, well, I tried to mention this to my doctor, but they didn't really pay attention. So as a doctor, I'm telling you, if you mention something to your doctor and they don't take you seriously, you need to find a new doctor. Or try again. Try again. Maybe it was just a bad day, there was something, but you have to have a doctor that you can trust. And part of that trust relationship is knowing that the doctor is listening to you. We may not have the answer for every ache and ailment, right? We are at the limits of science and knowledge. But if you have a legitimate complaint and it is not being investigated by your doctor, that is not the right doctor-patient relationship for you. And so it's no harm, no foul. You just say, thank you very much, and then you go look for the next doctor. And that's okay. But you have to be able to have a doctor that you feel comfortable bringing these things up with and knowing that they, on their end, are going to explore them for you. So now, what do you think? Can a woman develop breast cancer even if she has no family history of the disease? Yes, right? I told you that only about 10% of cancers have some genetic link. So the vast majority of cancers are what we call sporadic in development. So even if some people will tell me, oh, well, I don't go get mammograms because no one in my family has breast cancer. Well, I'm like, well, you could be the first one in your family. You could be the one to tip it off. So just because you don't have a family history of something doesn't mean you should not screen for it. And then genetic counseling for breast cancer. Right now there's a thought or a push to say that every woman that develops breast cancer should be allowed genetic counseling or genetic testing. Currently, insurance does not cover genetic testing for everyone, but our hope is that they would, because now that we know that there are so many genes that increase the risk of development of breast cancer and other cancers, we feel like everyone should be screened if possible. But some reasons that you might get screened for genetic testing is, one, if you develop a cancer at a young age. So if you develop a cancer at age less than 50, you should be offered genetic testing. If you have a strong family history, so if you have at least 2 other relatives with breast cancer, you should be offered genetic testing as well. And then, so let's take a second to talk about preventative measures. Preventative measures that you may discuss with your doctor if you're at an increased risk are preventative medications. So there are some women, we don't do this in men since their risk of breast cancer is so much lower, but there are some women who either have had multiple biopsies of their breast. So a woman who's gone in for imaging and get multiple biopsies, what their breast is telling us is that breast is very busy. It's doing a lot of that clumping of cells and making some abnormal changes. And so that woman is at a higher risk of development of cancer. And so oftentimes we'll offer them a medication we give to treat cancer called tamoxifen. We give them that to take for 5 years to slow down that activity of the cells in hopes of reducing their risk of cancer development. There are some women, of course, who have genetic mutations that we will screen their breasts more aggressively. So instead of just offering them 1 mammogram a year, we will offer them a mammogram and then 6 months later offer them a breast MRI so that we can screen their breasts more aggressively for cancer. So I think this is a little bit of a no-brainer. Cancer treatment is more successful when the cancer is detected early. Absolutely. I can't stress that enough about when someone comes in with a very small, early detected cancer versus when they come in with a very large or neglected cancer, meaning that they were in a little bit of denial before they came in. Always that person with the smaller cancer is usually going to do a lot better and hopefully sometimes have to undergo less treatment for their cancer. So let's switch gears from talking about things you do to reduce your risk and prevention to breast awareness. We used to be very, strict on this. You should be doing self-breast exams every month. Well, that's kind of fallen out of favor a little bit because a lot of times women will say, well, I feel my breast, but I don't know what I'm feeling. Or I have a lot of lumps and bumps, so I don't know when something's bad or something's good. And really what we were doing is fostering a lot of anxiety in patients, and we don't ever want to do that. So now the trend is to be breast aware. So you should absolutely know what your breasts feel like and know what your normal appearance is of the breast. That's very important so that when something does show up different, like that hitchhiking nipple or changes in the skin, that you notice it more readily. Mammograms are absolutely safe and they do not cause cancer. A lot of people get very concerned about mammograms, and really what they are saying is, you want me to expose myself to more radiation, but I thought you told me radiation was bad. You told me radiation causes skin cancer. You told me radiation can cause other cancers, so why would I get a mammogram? But the truth is, the amount of radiation you get exposed to from a mammogram is no more radiation than you would get exposed riding in your car for a few days. So it's very low level radiation and not enough to cause any problems. There are different types of mammogram. We recommend screening mammograms for women who are at least age 40 and above. If you feel a lump or bump or notice anything different with your breast, you don't get a screening mammogram, you get a diagnostic mammogram. And what that means is that there are a few more views of the breast are taken, but also that a radiologist has to look at your imaging before you leave the imaging center to determine if anything is abnormal. Just some basic guidelines for screening. Women aged 25 to 39 should be getting a clinical breast exam by a physician or someone. So I say this would be the same as you go, usually most women in this age group are going to the gynecologist at least once a year. So your gynecologist should be examining your breast as well as doing your pelvic exam. If you're a woman that's 40 and older, you should be getting a mammogram yearly. At MD Anderson, and most physicians do not support the idea of a mammogram every 2 to 3 years because things can change very quickly in the breast. So the breast should be looked at least yearly at minimum. Are there other tests you might need? Yes, depending on what we see. So most women go in for their mammogram and they may get called back for additional studies. Most of the time when you get called back, about 90% of the time when you get called back, is because something technical happened with the mammogram. So think about yourself going to get a mammogram. They're putting your breast in that little plate, and this lady's like smoothing the breast tissue out, and you're trying to hold your breath, not breathe, not cry, pay attention, suck it in, all these things, right? So they can get this perfect image. It's hard to do. So sometimes when they're taking the image, you might breathe, or the breast releases itself from the plate a little bit. Those are all technical things that make the mammogram not really good enough to read or to interpret well. And so those are reasons that you can get called back. And usually when you get called back, they do a diagnostic mammogram, so they take more images of the breast, and they often do an ultrasound of the breast as well. Because what they're trying to do is make sure that that area that looked uneven or abnormal, that they get it nice and flat, and that they can prove that it is just normal breast tissue. Occasionally, if there's something abnormal, you might get a biopsy, or you might be asked to get an MRI of the breast as well. Just a little bit of information about screening mammograms. You do not need a doctor to order a screening mammogram for you. You do not need a doctor to order a screening mammogram. So the excuse should never be, my doctor didn't order one. You can, on your own, call up. You can obviously, of course, go to MD Anderson. We'd love for you to come to MD Anderson for your imaging. But you can go to any imaging center across the country and just say that I want to get a screening mammogram. What they're going to do is make sure that you don't have any breast concerns, right? Because if there's something wrong, you can't get a screening mammogram, and you need a doctor to order the imaging, and they'll help you get in touch with your doctor for that. But if there's nothing wrong, you can do just like I do every year. I get my mammogram in September, so every year it's like August, and I'm laying in bed, and I'm like, oh my gosh, let me pull out my phone, and I Google MD Anderson screening mammogram, and I make my appointment on my phone. I choose the location I want to go to and the time that I want to go. We even do it on Saturdays now, and I just go for my imaging. And then I put what doctor I want them to send the results to, usually your primary care or your gynecologist or someone like that. But you do not have to wait for your doctor to write an order. In fact, your doctor would be very impressed that you were being proactive, and you came to them and said, I already got my mammogram, here are the results. But again, we have imaging centers across the Houston area. I guess the one closest to you all would be in the Woodlands here, but we have imaging centers throughout the Houston area. And then I'm wrapping up. These are the cancer preventive presentations that we provide through MD Anderson. These are free presentations. You may not always get a doctor to come out. I just happen to like to do them, and I was available for this one, so I did. But you will get someone who is knowledgeable. The content will be accurate. And they are just people who are really passionate about cancer screening and prevention and want to make sure you get all the information you need. Any questions? Sure, you had your hand up. Yes. So the one thing about preventative care, it's 100% covered by your insurance. So you put in your information. It is our job as the imaging center to verify your insurance, right? So let's say you've never got any imaging done at this center you're going to. So I can speak for MD Anderson because I know about that one. And I can tell you about Methodist because I send patients there too. But they will, you'll put in all your information, name, date of birth, you'll answer a bunch of questions. You'll fill in your insurance information if it is not already available to them. So if you've never been there before, they will then verify your insurance benefits. But all insurance companies cover screening and preventative studies.
What about if you don't have insurance?
If you don't have insurance, there are places throughout the Houston area. The one place that I can think of most commonly is the Rose. There are a couple centers across Houston, and they will do your breast cancer screening for free or reduced cost depending on your income bracket.
So I don't have to, so if you're in, say, like the KCC board system, you just schedule it. You don't have to go to your doctor?
Yeah, so even at Kelsey Siebold, you can call up and make an appointment for your mammogram. Yes.
Thank you.
You're welcome. Other questions?
I have a question.
Yes, ma'am.
So if my yearly mammogram keeps saying I have a dense breast tissue and this obscures possible cysts or something, should I keep doing yearly mammogram or should I get a different test?
Yes, you should keep doing yearly mammogram. So what she's asking is sometimes you get a mammogram and it might say extremely dense, heterogeneously dense, or fatty replaced breast. A breast that is fatty replaced is like the dream breast because you can see everything in it. A breast that is very dense has a lot of those lobes and lobules, and so it's very challenging to see in the breast. What they're saying is that we don't see anything, but you qualify for supplemental imaging, and so you could ask your doctor to order an ultrasound for you. You still need the mammogram. There is not a single test that replaces mammogram, but you can get an ultrasound as a kind of like an adjunct to help the mammogram be better. Other questions? These are all really good questions. Okay. Well, again, thank you so very much for your time and your attentiveness.
I had a question.
Oh, sure. Go ahead.
Hello. So, and I'm sorry I missed some of that, but
That's all right.
What about a DNA cancer analysis? I actually did one, and they did it for brain, ovarian, and breast cancer. And it came back that I'm low risk. Obviously, they can't guarantee no risk, but at low risk. How value added is something like that?
So essentially what it sounds like you had is that you probably had some type of broad-based genetic testing screening. It can never say that you're at zero risk. And what they're saying is that we did not identify any of the known gene mutations that increase your risk of X, Y, and Z cancers. That's essentially what it's saying. Those tests, oftentimes when people do them, sometimes people do them through something like 23andMe or these other like DNA, I think more so type of family tracing type DNA testing. And they do not replace the need for formal genetic testing should something occur.
Thank you.
You're welcome. Okay, well, if no one else has any questions, I'm going to sit down, I guess, so they can go on with the next steps. But I'll hang around a few minutes because sometimes people want to ask questions, but they don't want to ask questions in front of the group. And so I recognize that. So if you have any questions, feel free to come up to me. Thank you again.